Welcome to our Explain. In this video, we'll discuss what is narcolepsy and how to manage it. So what is narcolepsy? Narcolepsy is a sleep disorder characterized by excessive daytime sleepiness and sleep attack, plus cataplexy, which means loss of muscle tone and muscle weakness along with sleep paralysis. Narcolepsy causes sudden daytime sleep attacks due to poor management of sleep-wake cycles. The sleep-wake cycle is disrupted, and as a result, the daytime sleep attacks last for a few seconds up to few minutes. Some of the symptoms of narcolepsy include cataplexy, hallucinations, excessive daytime sleepiness, sleep disruption, and sleep paralysis. The DSM-5 diagnostic criteria for narcolepsy involves sleep, excessive daytime sleep, which happens for more than 3 times per week for more than 3 months, along with episodes of cataplexy. The pathophysiology of narcolepsy involves a disruption between wake-promoting neurotransmitters and sleep-promoting neurotransmitters. Wake-promoting neurotransmitters such as norepinephrine, serotonin, dopamine, histamine, and acetylcholine work together and they cause wakefulness. On the other hand, GABA is the main or key sleep-promoting neurotransmitter which increases sleep or decreases wakefulness. Besides GABA, hypocretin or orexin is a neuropeptide which has dual action on wake-promoting neurotransmitters. It involves both activation as well as inhibition of these. In a patient suffering from narcolepsy, there is significant decrease in the level of hypocretin. As a result, there is disruption of sleep-wake cycle, and patients suffer from narcolepsy along with cataplexy. Management of narcolepsy involves non-drug therapy followed by drug therapy. Non-drug therapy involves CBT, which means cognitive behavioral therapy, involving taking measures such as sleep hygiene, avoiding any stimulants, and psychosocial therapy. Drug therapy can be broadly classified into number 1, stimulants, oxybates, H3 antagonist, and dopamine and norepinephrine reuptake inhibitors. Stimulants increases the wake promoting neurotransmitters such as dopamine levels in the brain causes wakefulness. The problem with stimulants is they have life-threatening side effects such as rash and Stevens-Johnson syndrome. Drugs in this class include modafinil with the brand name of Provigil and armodafinil with the brand name of Novigil. Their usual doses are 200 to 400 mg per oral in the morning, 150 to 250 mg per oral in the morning respectively. Armodafinil and modafinil are same except that armodafinil is basically an R isomer. That's why the name indicates AR. Second class of agents which are FDA approved for the management of narcolepsy are oxybates. Oxybates are derivatives of GABA aminobutyric acid. As a result, they increase sleep. These drugs should be taken at night along with stimulants at day to manage narcolepsy. They also manage cataplexy. Moreover, by restoring the sleep at night and taking stimulants at day, they are of particular importance in management of narcolepsy. The problem with these drugs are that they are stronger CNS depressant drugs. Therefore, they should be contraindicated with drugs such as alcohols, sedatives, as well as barbiturates and benzodiazepines. Drugs in this class include sodium oxybate and calcium, potassium, magnesium, and sodium oxybate. If you look at the structure of sodium oxybate, the rest of the structure is same to that of GABA except the presence of sodium. And same is the case with that of calcium, potassium, magnesium, and sodium oxybate. Sodium oxybate usual dose is 4 to 9 grams per oral at night in divided doses. Its brand name is Xyrem and it should be taken after food. The first dose is taken at night, that is 2.25 grams per oral, and the second dose is usually taken 2.5 to 4 hours later. It onset starts within 10 minutes usually. However, if the patient is not asleep, the second dose should be taken. The calcium, potassium, magnesium, and sodium oxybate usual dose is 6 to 9 grams per oral, and its brand name is Xevav. It is of particular importance to note that Xevav contains 92% less sodium than sodium oxybate. Therefore, it is recommended in patients which are on strict dietary control of sodium. These drugs are not given without a prescription and highly controlled because of their illicit use. Especially, they are date rape drugs and that are sedative. Another class of drugs which are used in management of narcolepsy are histamine 3 receptor antagonist or inverse agonist. Histamine 3 receptors is an autoregulator of release of histamines, and by blocking the H3 autoreceptors, there is increase in the level of histamines in the body, and histamine promote wakefulness. Drug in this class is pitolisant, and its brand name is Wakix, which comes in 4.5 to 18 milligram strength. Its usual dose is 8.9 milligram at week 1, up to 18 milligram in week 2, and up to 36 milligram in week 3, if the desired effect is not achieved, that is management of narcolepsy. It should be noted that pitolisant should not be given to the patients having significant hepatic impairment because it is metabolized by liver. Moreover, this drug causes QT prolongation and should be avoided in cardiovascular patients. The last class of drugs which are used in narcolepsy are dopamine and norepinephrine reuptake inhibitors. They block the dopamine and norepinephrine reuptake. As a result, they enhances the wakefulness and should be given in daytime. They increase blood pressure and heart rate, and the only thing which should be particularly emphasized is they should not be used with monoamine oxidase inhibitors because of increase in the level of dopamine and norepinephrine. Solriamfetol is a drug belonging to this class, and its usual dose is 75 to 150 milligram per oral. The brand name of solriamfetol is Sunosi. Overall, the narcolepsy should be managed with the non-drug treatment, which involves CBT, which means cognitive behavioral therapy, taking measures such as good sleep hygiene and avoiding any stimulants which causes disruption of sleep-wake cycle, followed by drug treatment. The overall goal of drug treatment should be: number one, enhances or causing the wake promoters plus cataplexy management, and the second one is sleep promoters at night plus cataplexy. Drugs in this class include modafinil, pitolisant, solriamfetol, and oxybates belong to this class. Oxybates are usually given in conjunction with wake promoters at day. Modafinil is of particular importance because modafinil is the first line of agent in wake promoters, followed by pitolisant and solriamfetol. However, modafinil is associated with Stevens-Johnson syndrome, and it also decreases the oral contraceptive effect. Therefore, it should not be given if oral contraceptives are taken at the same time. The second class of agents which are used in management of narcolepsy are modafinil and stimulants such as methylphenidate, amphetamine, dextroamphetamine, as well as other agents are used as second line because they are associated with illicit use and abuse. I hope you find this video useful. If you like it, kindly subscribe to this channel and give it a thumbs up. Thank you for your time.